We're now, less than a week away from families across the country getting together for Thanksgiving. And beyond the weather, all before we see our loved ones, we wanted to get you caught up with the very latest health headlines. That is a reality these days. So we have NBC News senior medical correspondent Dr. Torres here with us this morning.
Good morning.
Good
morning.
I don't know anybody who hasn't been untouched or at least knows somebody between RSV, the flu, COVID, and now we're all getting together. And it's weird because we're not really wearing our masks anymore. You know, so I think we're trying to figure out how to protect ourselves.
And, you know, and this is the holiday that I think we should just have as much of a normal holiday as we could that we haven't had the last 3 years.
Yeah.
But what that means is doing things still with a little bit of safety in mind. And that's remembering we are in the middle of the tridemic now. Yeah. And so we need to protect ourselves and our loved ones, especially the ones that are vulnerable, the very small and the elderly or those possibly with kind of immune problems. At the same time, realize that, you know, getting vaccinated is your first key and the thing that can help you the most. The question I get all the time is, if I get vaccinated now, will that help me for Thanksgiving, which is less than a week away? The answer is every day after you get your flu vaccine, you get some protection. It takes 2 full weeks to get fully protected, but a week from now, you'll still have some protection with the vaccine, so better than not having it.
Nothing.
And then you'll have it for the follow-up holidays that come on. Yeah. Main thing is just keep safe. You know, as far as testing, possibly if you think people are sick, you know, people are vulnerable and you want to make sure, or they're strangers you don't know coming into the house. At the same time, the biggest advice I can give to everybody, if you're sick, stay home with us. You think it's cold, flu, RSV, COVID, any of those, stay home.
As you know, my kids have dealt with RSV recently. So you mostly think about it for kids, but what are the impacts for folks over 65 years old?
And it turns out that those have the biggest impacts, the people over the age of 65. And if you look at the statistics over year to year, around 1 to 400 children each year die from RSV. And that's more, you know, many, many more than need to die from RSV. Unfortunately, around 14,000 adults above the age of 65 die from it every year.
Really?
177,000 get hospitalized because of it. And so that's the age group that tends to hit the hardest. We just don't remember that or realize that. And part of it's because it is a respiratory problem. Their immune systems aren't as strong. And so when we talk about protecting the young children, definitely need to do that. But we also need to think about protecting our seniors as well.
Keep sick kids home, too.
Exactly.
Speaking of young people, while we have you here, I want to ask you about this, this WHO report. The World Health Organization recently announcing that 1 billion young people, that's a B, 1 billion young people are at risk of hearing loss because of unsafe listening practices. What constitutes unsafe listening?
You know, and to put it in perspective, right now they estimate about 430 million people around the world have hearing loss. They think that might go up to 1 billion young adults over the next couple of decades because of some of the things they're doing. And the things they highlighted were concerts and what they call personal listening devices. Earbuds. Right, think earbuds. And on the average, they found out in a study that on the earbuds, they're listening to 105 decibels on the earbud. That's the same level as a jackhammer. Jeez. And so they're listening to it real close to their ears. And the concern is for how long you have them in your ears. Yeah. It turns out at 101 decibels, anything over 19 minutes will start giving you ear damage. And so we're talking, you know, people have them in for hours at a time listening to these things. And the rule of thumb I always give people, I say, you know, number one, you know, think about what might cause, you know, the symptoms you might have from hearing loss. And number one, you know, if you're having to have people repeat their words, if you're in a closed environment where you're listening to a lot of you're in a crowded environment and you can't hear somebody, you can't focus on them talking to you, that's another one. And then ringing in the ears is definitely something you need to worry about because that shows that the damage is already starting to set in there. But the biggest rule of thumb I give them is if you're standing next to somebody and they can hear your earbuds, that's way too loud.
Absolutely. I interviewed a tween. She lost her hearing, significant hearing loss, because they would sleep with their earbuds in their ears. She was a tween. You know, you're going to sleep, you're watching stuff.
And if you think about it, I mean, that speaker in the earbuds is that far away from your eardrum.
Oh, my goodness.
Good stories this morning.
Thank you, Dr.
You bet.
Next time we want to talk about the melatonin thing.
Oh,
next time
yes.
So have a good weekend.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.